Okay, I think it's time for us to begin. Welcome everyone to this event sponsored by the Institute for Spirituality and Health. The Church Confesses. We have a wonderful lineup of speakers, reflectors today, and we'll have plenty of time for Q&A at the end. To begin, I'd like to introduce the President and CEO of the Institute for Spirituality and Health, Dr. John Graham. He will give an invocation and briefly introduce the event. So welcome, John, and take it away.
Welcome, everyone. Of course, we've been in a very interesting time with COVID, but also the death of George Floyd, which has contributed to a great emphasis on dialogue. And what should we do and how should we respond to all of these different events? The church plays a unique role in shaping conceptions about what is right, what is wrong, what we should do, and when we should respond in crisis moments, how we can be more Christ-like to our neighbor and to one another. And so there are a lot of questions that are going to be raised by these wonderful speakers, great panel. I'm excited to hear them. And how should we understand what the church's role is, its voice, in a crisis time? And that's where we are right now to think about that together. This is both theological, but it's also at the congregational level, the very personal heart level that each of us must deal with. And so the remarks of these speakers are going to be very influential in our own conversation together as we have question and answer time. Let us pray. The gracious and ever-loving God, we thank you for the opportunity for us to gather together. We look to the questions that have been brought and mentioned, and that are mentioned every day, the disparities between different races and what is going on in our churches. Are we ignoring the issues that are there, or are we responding to them? I pray, Lord, that this time we have together will help clarify what must be done and what can be done, and guide us in that direction, we pray, as we continue in this meeting on this particular day in our lives together. Amen.
Thank you so much, Dr. Graham. Appreciate your remarks as well as that beautiful invocation. It's my honor to introduce now our first speaker, as well as the person who will be serving as a moderator during our discussion at the end of the program. Claire Hein Blanton, Reverend Claire Hein Blanton, is a doctoral student in systematic theology and ethics in the Department of Divinity, History, and Philosophy at the University of Aberdeen. Her research is broadly investigating the political theology of Dietrich Bonhoeffer, with special interests in a close reading of Bonhoeffer with Martin Luther. Claire is a graduate of Rice University and Truett Seminary, Baylor University. She is a Texas Humanities Grant recipient and was a Baptist Joint Committee for Religious Liberty Fellow for 2018. Claire is also an ordained minister and frequent Sunday school teacher here in Houston, Texas at South Main Baptist Church. Claire, we are so thrilled to have you here and look forward to your remarks.
Thank you. I'm excited to be here and be on this panel with so many great speakers. So to begin, I'm going to give some opening remarks on how to be a good neighbor. German pastor and theologian Dietrich Bonhoeffer is perhaps not well known as a champion of healthcare. He may seem then an unlikely interlocutor for the panel discussion on reflections on health justice. He is often remembered not for his theology, but for the brief period he spent working for a German counterintelligence resistance group during World War II and his subsequent execution. What then does he have to say on health justice? Bonhoeffer's manuscript Natural Life certainly touches upon some health rights, but there is perhaps a more deliberate way to engage with Bonhoeffer during this period of uncertainty than trying to contrive a series of coherent thoughts from a single piece of work. Bonhoeffer certainly understood what it meant to live in a period of turbulence and alienation, similar in some ways to how we find ourselves now, both in the midst of COVID-19 and in the reckoning, in America at least, of its long and continued history of racism. This has been a time to reflect and ask, what should we be doing differently to enact positive change in our society? And to this extent, I propose that Bonhoeffer offers much on the subject. How do we posture ourselves in a way that strives to put the other's needs ahead of our own? Bonhoeffer's classic text, Discipleship, instructs Christians to conform to Christ. It is through this confirmation and subsequent confession that we begin to love the neighbor. This brief opening remark, then, will accomplish 3 tasks. It will first touch upon what confirmation to Christ means via discipleship. It will then address how this confirmation shapes the behavior of Christians. And finally, as a way to open up for further discussion, I offer some thoughts of the applicability of Bonhoeffer's ethical action to our modern health crisis. In the preface to the work Discipleship, Bonhoeffer suggests that the need has arisen for the church to again ask, what did Jesus want to say to us? What does he want from us today? And how does he help us to be faithful Christians today? These questions articulate an essential posture for the Christian, that to be one is to be conformed to Christ, an ongoing process rooted in the patient waiting and response to God's call. In due course, Bonhoeffer explains more fully what this means, but critically, in a work which is not directly about ethics, Bonhoeffer's Discipleship is inherently ethical. Belief and faith directly connect to action. Works are not required for salvation, but a faith without production of works is suspect. Bonhoeffer distinguishes between a cheap grace and a costly grace. A cheap grace understands itself as transactional. The sinner is justified in faith, but nothing more is required. Even wrong action may be permitted without profound worry, because God's grace covers all sinful action. Costly grace, however, recognizes the totality of God's grace in justifying the sinner, even to the extent that it covers future sins. But in its recognition, transforms the individual into something more than he was previously. His future sin weighs more heavily because of this understanding. Bonhoeffer comments that Luther can proclaim to sin boldly only because he accounts for the ongoing sinfulness of humanity as something not to be feared, but rather accepted in the ongoing process of conforming to Christ. To quote Luther, "You are a sinner, so just be a sinner. Do not want anything else than what you are. Become a sinner again every day and be bold in doing so. But to whom could such a thing be said, except to those who from their hearts daily reject sin, who every day reject everything that hinders them from following Jesus, and who are still unconsoled about their daily unfaithfulness and sin?" Costly grace, then, not only calls the individual into the possibility of suffering and death, but that in being conformed to Christ, the individual may incur future sin and guilt in his ultimate responsible act. Discipleship, then broadly construed, is a bold adherence to an impossible situation. To follow Christ's call and be obedient means risking sin and guilt. Bonhoeffer sums this up with 2 statements: only the believers obey, and only the obedient believe. In his work on obedience and moral discernment, Joshua Kaiser draws upon the active nature of this. To be both a believer who obeys and simultaneously an obeyer who believes presumes immediate action without moral reflection. The tenability of this aside, what Bonhoeffer argues for here and continues elsewhere is that to follow Christ is to live in the present concrete situation and wait upon God's call. Ethics follows discipleship not only in the writing process, but deliberately in the life of the Christian. Simple obedience and conformity are not only hallmarks of discipleship, but essential for the health of the church. This extends beyond the life of the individuals in the church, but to the life of the individual Christian within their other spheres. Bonhoeffer is not naive to the fact that this type of discipleship within various orders is difficult, but participation in the various orders, as participation in the church, requires a type of devotion to simple obedience and discipleship that he found wanting in his period. And to explore this further, we'll now turn to his work, Ethics. Unlike discipleship, Bonhoeffer's ethics is incomplete. Begun at the end of the 1930s, he worked on the various essays, which now comprise the work until his arrest. As a result, different pieces exist in different states of completion. Yet, a coherent theme of Christian response is carried through the collection. building upon the joint ideas of the Christian both being conformed to Christ and practicing costly discipleship. Bonhoeffer rejects standard formulations of ethical models in favor of one translated as vicarious representative action. And I'm not going to try to say the German word there because I know I cannot say it well. That is to be Christ to the neighbor. As a result, Christians are called to live in responsibility to the concrete neighbor. Quote, the moment a person accepts responsibility for other people, and only in so doing does the person live in reality, the genuine ethical situation arises. This is really something different from the abstract way in which people usually seek to come to terms with the ethical problem. The subject of the action is no longer the isolated individual, but the one responsible for other people. The action's norm is not a universal principle, but the concrete neighbor as given to me by God. As Christ takes on historical concrete action, the Christian too takes concrete responsible action. Christ's actions found their base in God's love for the real. Quote, love for real human beings leads into solidarity of human guilt. In vicariously taking responsibility for human beings, and in his love for the real human beings, Jesus became burdened with guilt. And Jesus Christ is the very embodiment of the person who lives responsibly. He is not the individual who seeks to attain his own ethical perfection. Instead, he lives only as the one who in himself has taken on and bears the selves of all human beings. His entire life, action, and suffering is vicarious representative action. To act as Christ is to bear this guilt out of love and solidarity. And here, Bonhoeffer offers a concrete example, drawing upon a hypothetical proposed by philosopher Immanuel Kant. If your neighbor asks to be hidden in your home, and the men chasing him come to your door and ask if he is there, how do you respond? Kant claims that one must tell the truth and thus give the neighbor up to his fate. Lying is always unethical. Bonhoeffer, however, claims that you should lie to the men and protect the neighbor. It is not that lying is not unethical and prohibited by the Ten Commandments, but rather it is better to bear the guilt of the lie and save the neighbor than remain blameless. God forgives the guilt of the lie because the command to be Christ to the neighbor is more important. Of course, this does not mean that Christians are freedom to blatantly sin. Rather, they are able to bear the guilt of sin in acting as Christ because Christ too bore the guilt of sin to rescue humanity. It is the distinction between both cheap grace and costly grace and following ethical models versus conformation to Christ that leads the Christian into responsible action. This is certainly the harder path. Which brings me to my final section, perhaps an opening for the following presentations. What does it mean to practice this during our current time? This is perhaps the perennial question for those who engage with Bonhoeffer. Too many rely on his biography to design a course of action. They point to his final years as evidence that radical action must be taken. And yet, his theology offers a much clearer picture of the word he might speak to us today, which is first and foremost, wear a mask. At this moment, we are faced with an alarming number of questions that I doubt most of us have seriously considered prior to this year. Is it safe to go to the grocery store? Should I homeschool my children or send them to school? What are my wishes if I end up in the hospital and am all alone? None of these have clear answers, and I spend a good portion of my days now evaluating the relative risks and merits of decisions I would have made 6 months ago without much thought. And I realize that part of this is my relative privilege and luxury to even have these decisions to make. I am very aware that there are many within my city and state and country that do not have the ability to decide whether they can work from home or if they can keep their young children at home all day. But certainly there are things I and my family can do to be better neighbors to those immediately around us and to those further removed. We can wear face masks without complaining that it is an infringement on our liberty. We can choose to support our local schools struggling to make decisions that take into account that 75% of the students in the Houston Independent School District are economically disadvantaged and receive some measure of social support, such as free and reduced lunches, through the schools, and that there is an inherent danger in face-to-face instruction while there is still no vaccine. We can choose to donate blood and donate our time to helping essential workers and healthcare providers that are overstretched for time and energy. We can advocate for better policies that recognize that lower income and individuals of color are at increased risk of dying, especially as brought to attention last week, looking at Bel Air and Houston versus Gulfton right next door. The disparity between cases is quite alarming, and a lot of that is divided on racial and economic lines. And most of these decisions have some negative impact on my life. I do not like wearing a mask. I want schools to reopen so my son can see his friends and I can work in relative peace at home. And at the same time, I know that there is a greater call to responsible action because I am trying to be conformed to Christ. Perhaps the best example I can offer of how the church can respond comes from a very concrete example in Texas in the early months of the pandemic. Initially in our county, houses of worship were supposed to be closed. Ministers could still do their work, but large group settings were considered dangerous and ill thought out. A group of Houston ministers and one politician filed a lawsuit against the county to open up churches again, and our governor acquiesced. Our family is desperate to return to our normal church life, but my husband joked that day that if our pastor opened our church back up before it was safe, he was going to cancel our pledge for the year. Later that day, as it would be, the local NBC affiliate interviewed our pastor, who rightly said that it was unsafe to open churches back up no matter how much we wanted to do so. Our church's first priority was to do no harm. This has become our guiding principle during the pandemic. How can we do the least amount of harm? We are a single household in a giant city, but if we are being attentive to being conformed to Christ and practicing responsible action, our first priority at this moment is to do no harm to our neighbors. In his section from Ethics, Guilt, Justification, and Renewal, Bonhoeffer offers various confessional statements from the perspective of the church. The overarching premise of this essay is that the church has failed in living out its calling to proclaim the gospel and be a good neighbor to those in its midst. He writes, by falling silent, the church became guilty for the loss of responsible action in society, courageous intervention, and the readiness to suffer for what it acknowledges right. Perhaps this time now calls for us, both the church and as individuals, to acknowledge the ways that we have not been good neighbors during the pandemic or during our regular lives, and to strive for better, just as Bonhoeffer in the midst of the Third Reich held on to the belief that both the church and Christians could do better in our societies if we recalled what responsible action entailed and practiced it more freely and regularly. Thank you.
Thank you so much, Reverend Blanton. Really appreciate those profound comments and look forward to the discussion a little bit later. Our next speaker, or reflector speaker, is coming to us from Aberdeen, Scotland. In some ways, the pandemic has caused more isolation, and in other ways, it's allowed us to be connected in ways we didn't imagine before. So really appreciate your being here. Dr. John Swinton will speak on the hidden sources of suffering, racial inequality, COVID-19, and the need for a theology of generosity and trust. Dr. Swinton is professor in practical theology and pastoral care and chair in divinity and religious studies at the University of Aberdeen. For more than a decade, John worked as a registered mental health nurse. In 2004, he founded the University of Aberdeen Center for Spirituality, Health, and Disability. The center aims to enable academics, researchers, practitioners, and educators to work together to develop innovative and creative research projects and teaching initiatives within the areas of spirituality, health, and healing, the significance of spiritual dimension for contemporary healthcare practices, and the theology of disability. He has published widely within the area of mental health, dementia, disability, theology, spirituality, and healthcare, qualitative research, and pastoral care. Dr. Swinton is the author of a number of monographs, including Dementia, Living in the Memories of God, for which he won the Archbishop of Canterbury's Ramsay Prize for Excellence in Theological Writing. It's an honor to have you here today, Dr. Swinton, and look forward to your remarks.
Thank you, Stuart. And thank you for the invitation, and it's nice to meet you all. And Claire, thank you for an excellent paper. And I'm glad that you chose the world's best university to study, and that's very good. Well done. I was trying to think what might be an unusual but helpful angle to bring to the conversation. So I've been thinking a lot about the pandemic recently, both in terms of theology, culture, pastoral care. And I just want to share a couple of things with you. Obviously, the pandemic is complicated both in what it is and both in its implications. So it's brought deep suffering and loss, often to the most vulnerable people amongst us. So theologically, we've had to wrestle with that big question of where is God in suffering and why does God allow suffering? And in the midst of lockdowns, social distancing, what does it mean to be the body of Christ in the midst of anxiety, infection, and death? Of course, at the level of suffering, it's pretty obvious that the God that we worship is a God who suffers with us, who shows solidarity in our suffering. At the heart of our faith is the crucified God who suffered and died in order that we might find redemption. So God is no stranger to suffering. And the suffering of Jesus helps us to get that sense of solidarity with us in the midst of our trouble. And Jesus' healing ministry indicates to us where we should be in the midst of suffering. The suffering God is with those who are suffering. But suffering is a complicated thing, and it's not always obvious what suffering is. So we look at the coronavirus, and at one level, it looks really obvious what the suffering is. But I want us just to dig into two dimensions of suffering that are easily overlooked, but probably very important for our conversation and for others. So the first source of suffering, if you like, is the relationship between the coronavirus and race. So at one level, the cause of the pandemic is obvious, a virus named COVID-19. But there's more to the story of suffering than the direct impact that the virus has. So we've already seen in our different contexts, in our different cultures, different countries, the ways in which the pandemic has been politicized, as it's taken out of its medical context and used in various ways to score political and social points across parties. The virus has side effects, which are political, social, and economical, as well as medical. But there's one side effect of the virus that I think we should at least consider, and that's the relation to race and its potential impact on race relationships at a personal and at a political level. So it's been noted, and Claire highlighted it earlier, that people of colour are more prone to the coronavirus than others. And this has to do with various social, political, economic, and perhaps biological factors, which are well documented and which people are continuing to think through. But there's one aspect of this situation that I haven't seen articulated in any depth, and that's how the language of the pandemic can be weaponized against minority groups. So the psychologist Mark Shaler has developed this idea, which he calls the behavioral immune system. By that, he's referring to a cluster of psychological mechanisms that allow organisms to detect the presence of harmful disease, parasites, or disease-ridden substances. So at its simplest level, the behavioral immune system creates the experience of disgust and recoiling when you experience a foul smell, or revulsion when you see a pox, the mark of a virus, and the pustules that accompany it. Now, the benefits of this mechanism are obvious. Illness in an individual illness is an individual and a communal threat to survival and well-being. So you can see that would work itself out in terms of our evolutionary history. But there is, however, a problem with this system. It doesn't like to take chances. So it's very sensitive. It tends to err on the safe side, which has significant consequences for individuals, communities, and also for political systems. So the behavioral immune system can quite easily be hijacked into thinking that certain groups are unclean and the rightful objects of avoidance. So for example, some may consider homeless people, people of another color or race, or people with facial disfigurements, potentially pathogenics and worthy of avoidance, even in fact that there's no threat of infection, but you stimulate that system and you begin to avoid. So alongside of this is the uncomfortable connection between the stimulation of the behavioral immune system and the background for preparing the ground for historical atrocities. So Nazi propaganda calls Jewish people people of contagion, infection. Rwandan genocide participants called Tutsis cockroaches, carriers of infections. This kind of language talks directly to the behavioral immune system and stimulates that, and the consequences are obvious. Likewise, if we think about recent horrible manifestations of xenophobia against Asian people, we can see why the term Chinese virus or Chinese flu specifically associates certain people as unclean, something that again resonates powerfully with the behavioral immune system. Now, this relates to health inequalities in important ways. Writing in the journal Psychology Today, Joshua Rotman makes a very interesting observation. He says this. He says, all of the evidence suggests that heightened anxiety about the novel coronavirus may be contributing to heightened manifestations of bias, especially given that people of color have been disproportionately struck by COVID-19. It seems possible that prejudice and discrimination have been compounded during recent weeks, due in part to a chronic upregulation of the behavioral immune system or systems. Clearly, there are many factors that have contributed to the unspeakable tragic killings of George Floyd, Breonna Taylor, and numerous others, he says. Racial prejudice and police brutality have long predated the appearance of COVID-19, of course, but it's possible that the coronavirus has fueled them even further. Now, the point is not that the virus causes racism, but it can feed into it if it's framed in particular ways. So we need to be very careful when we discuss the fact that there are a higher number of people of color living and dying with coronavirus, because that's not simply a medical fact, it's a very powerful social fact with potentially dangerous social consequences. If we develop a cultural imagination that sees one group of people as more diseased than another, we can easily lay the foundations for dangerous responses and for toxic politics. It's not necessary to be an evolutionary biologist or a behavioral psychologist to realize that chronic anxiety and insecurity can provide an ideal context for noxious politics. And it's more than probably not a coincidence that since 2007, the crash of 2007, there's been a rise of right-wing politics across Europe and a rise in a certain type of nationalism. Anxiety and insecurity pushes people in particular directions. So the virus does not cause toxic politics, but once again, it speaks into the formation of a context which is ripe for the sowing of negative political seeds. The virus has side effects that have significant implications for both church and society. And my second point ties in with that and maybe gives us a pointer as to where we need to go to counter that kind of side effect. My second point is slightly different, but still connected with COVID. If we're to deal effectively with the coronavirus and its medical, social, and ultimately spiritual side effects, we need to create a context where trust and generosity are the key goals. At the beginning of the pandemic, I was in Australia on sabbatical. I was living in Sydney. And I noticed that there, people yielded to the temptation to hoard food, water, and indeed toilet rolls. You couldn't get a toilet roll in Sydney for love nor money. It was the most bizarre thing for an airborne virus. So they did this though, in the knowledge that by hoarding goods, they were depriving the most vulnerable within society and increasing the overall suffering of the community. That's in spite of the fact that there was more than enough food to feed Australia several times over. And I know that phenomenon runs across various countries. So the virus, it seems to me, has revealed to us what Walter Brueggemann has described as a scarcity mentality. The fear of not having enough, though it's obvious that in fact there is enough to go around. Brueggemann notes that in the Old Testament, the people of Israel developed a similar scarcity mentality. They always lived in fear that they wouldn't have enough, and even when they did have enough, they lived in fear of losing it. They worshipped a God who promises abundance, and yet they live in fear of scarcity. And there's something very powerful about that for our own society. One powerful thing that churches can bring to the table of healing in the midst of the pandemic is a manifestation of generosity and communal responsibility. We worship a generous God who has provided all that we need if we are willing to share it and to use what we have faithfully. Generosity, of course, is not simply a financial thing. It involves the generosity of spirit that seeks to care for our neighbour and to ensure that their needs are met, and that includes their healthcare needs. And just to go back to Claire's point, that includes the significance of masks. I have no problem with people having the right not to wear a mask. I have a great problem with their right kills my elderly mother. So there's something about communal responsibility is profoundly important and is revealed as lacking by the virus. So generosity relates to the language we use, how we talk about one another, and an awareness of the ways in which the way we speak about one another can have profound consequences at every level of society. A theology of generosity has important healthcare implications. What does it mean to be generous with our healthcare provision? What does it mean to be generous to the healthcare needs of the poor? What does it mean to be generous to the healthcare needs of people outside our own communities or outside our own countries? These kinds of questions come to the fore when we're faced with something like the pandemic. The question is, how will those of us who worship the God who is generous respond to these questions? Thank you.
Wow, thank you so much, Dr. Swinton. So appreciate your comments, and I'll be reflecting, I know just myself, I'll now be reflecting on the behavioral immune system for the next who knows how long. So thank you. Our next speaker is somebody who I personally have great admiration for. Not that that's not true about all of our other speakers, but I had the pleasure of meeting him early on in my entrance into this landscape of spirituality and health, and have admired his work here in Houston for some time. Dr. Matthew Russell, Reverend Dr. Matthew Russell, is an academic, activist, pastor, professor, and teacher. He's on staff at Chapelwood United Methodist Church in Houston and is the executive director of Iconoclast Artists and Project Curate, which is a nonprofit educational and social enterprise incubator that seeks to build bridges across cultural, economic, religious, and racial divides in Houston. He's taught at Duke University, Fuller Seminary, as well as completing a 2-year postdoctoral fellowship at the University of Cambridge in psychology and religion. In 2010, he completed his PhD at Texas Tech University in human development, where he explored how women construct alternative narratives of redemption from years of sustained trauma and abuse. Prior to this, he planted and pastored a church called Mercy Street, a church for people that hated church. Matt has worked extensively with ex-offenders and recovering addicts. He is helping develop initiative curricula for public schools, which seek to provide pathways of learning and economic opportunity for kids in the inner city. Today, he'll be speaking to us on the theme of the descending church towards a theological imagination of equity. Dr. Russell, thank you so much for being here.
It's a real honor to be here with y'all. I hear my bio being read, and I can feel my mother saying, Matt, pick something. Will you just pick with something and stick with it? Alas, but it really is an honor to be here. Claire, I appreciated your remarks up front. Dietrich Bonhoeffer was someone that has really shaped my own theological and social imagination. I had a main professor at Fuller, Ray Anderson, who taught the Bonhoeffer class, and something inside of me woke up when I was confronted with him. And it was really a confrontation with his work, and so and that has really, I think it was Bonhoeffer's work that then introduced me to Barth, who I needed a lot of translation with, but then even more importantly to Latin American theologians, and then to African American theologians, and then to this whole other array of kind of getting out of this white dominated theological landscape into a place that was really helpful to me. So thank you. And Dr. Swinton, your book From Bedlam to Shalom was my entrance into your work, and Ray Anderson introduced me to that when I was in my work with recovering addicts, which is deeply helpful. And so thank you. And Dr. Smith, I've heard about you a lot. And I've gotten a lot of emails from folks saying, "Oh, you got to meet Dr. Smith." So I'm excited. So I come today at this discussion really as a pastor, as an activist, and so my work and my imagination has been shaped and really embedded in the life of the local church. I would say shaped and sometimes misshaped. And so, but when I think about the local church, I'm not talking about the local church as a concept or an idea or something that we kind of deconstruct in a classroom, although I do that. And I find that to be a lot of fun to do with students. But the church really as an event, as rooted in the soil of the particular, in a particular context, in a web of relationships that live under congregations and that congregate under names like St. Paul's United Methodist Church, congregate under names like Mercy Street, that live under the names and make their way under and try to figure out their faith with fear and trembling under the name of Chapelwood United Methodist Church, where I'm at now. And so when I think about the church, I'm not ignorant of the global community. I'm not ignorant of this kind of theological construct, but it's been a work and a movement of mine personally to be rooted into a particular soil. And so in some ways, I've become to understand that all theology is really local. It has global implications for sure. I mean, Jesus just shows up and just rocks it, right? I mean, he rocks all of our world. But there's a local thing that's been worked out in a collection and affordances of relationships that we have that are particular to the place that we're at. And so that's where I've been deeply shaped in these communities. And then the community of iconoclast artists and Project Curate, these two communities that really hold for me binocular expression of a way that the church can stand in the midst of racial divide and divides around educational divide and equity, as an attempt to, in the words that I just love hearing John Lewis's words these last couple of weeks, and I hope they don't fade, but his notion that the church needs to get itself into some good trouble and some good local trouble. And so that's been really from Bonhoeffer into this movement has been really this call for the local church to get itself into some good trouble. Which I will say for predominantly in worship communities that I've been a part of, the white church, and I'll talk particularly from my own context. So which is a predominantly white context, and I know that that's painting the whole white church with a broad brushstrokes, but in some ways of doing that will be important. But I'm talking out of my own local experience here as well. For the most part, the white church has attempted to stand back and has kind of resisted fully moving into the world in the way that our Black and brown siblings have been urging us to move. And so we're apt to involve ourselves in serving the poor. And finding a lot of ways to serve, but never really asking ourselves that question that is always in the shadows and within white communities, which is, why are they poor, right? And so we can show up, and we need to hold these things together. They have to be held in tension. We have to ask, where are the hungry folks? If that's one of the questions that we're called to ask. Where are the folks in prison? Where are the widows, the orphans, the strange? We have to ask that question. And then we're also called amid that to ask this other question of justice, which is, why are there so many folks in prison? And why are there so many African-American male in prison? Like if we don't ask that question, we can end up whitewashing the entire gospel as a church and find ourselves in some ways um, um, acting as if we are the church, but giving up the very mission of Jesus, right? So the name in front of a church, I don't think constitutes that it's the church. I think, I don't know if Bonhoeffer would say this or not, so I'm taking grand liberty here. And so don't unmute yourself, Claire. The Bonhoeffer might say the sign in front of the church represents a great possibility. Is the church becoming the church in its actions in the world? Not just in somehow kind of taking these creeds and making sure we polish them, right? And so when I grew up, evangelism was really posed really about, we've got it, you need it, how about it? You know, that was the question of evangelism, but we had it, right? And you needed it. Or it worked itself out in ways of trying to have elegant thoughts about Jesus and then really coming into conversation with you and confronting you and your thoughts about Jesus as being not good enough. And really, if you had better elegant thoughts about the nature and the character of Christ, then you could become a Christian. And then we come to Matthew, the end of Matthew, where we see this great divide happen. And we begin to see that it's not in our elegant thoughts about Jesus, but it really is in the incognito of Christ, a phrase that I'll steal from Dietrich Bonhoeffer, that Christ moves into the incognito in the world. If the Spirit of the living God has been poured out on all flesh, I mean, all flesh, not just white flesh, not just Christian flesh, you know, not just flesh that lives in certain places or thinks certain thoughts. But if it's been poured out on all flesh, then the very God is in the world really reconciling, calling the world back to itself in a way. And to the degree that the church is caught up in that, is given itself to that. Is to the degree that whatever that sign says on the front at church, it's living up to. And so the global pandemic, these images of Officer Derek Chauvin's knee on the neck of Ahmaud or George Floyd, and the world watching and pleading in real time that this man live and watching him die, adding this to the images, the recent images of Breonna Taylor, Ahmaud Arbery, exposed, I think, an anger, a frustration, an illegitimacy that has been placed upon, a lament that our Black and brown siblings have been crying out for. But for the most part, the white church has been able to live in a way that is distracted, to live in a way that is suburbanized the gospel of Jesus. Literally and figuratively because of that. And so for the most part, we have not had to hear these voices, despite each week confessing every week, we have not heard the cry of the needy. Right? So we become in this kind of complicit, nefarious act that we somehow shellac a bunch of Jesus on top of and confession on top of, but it does not change where our feet are, where our economy goes, the way that we construct the world that we live in. And so I think the fact that I live in a city of Houston that has, I've heard different stats, but they're all sickeningly true, whether it's 65 or 75% of all kids in HISD go to bed hungry. That to me is not a sociological issue. It's an ecclesial issue. It's a problem that the church has. And if the church does not make that one of its problems, right? Not just asking, where are the hungry, but why are people hungry? We have operated in a way that may have some social benefit. It's just not the way of the church. It may have we may provide some relief in areas. It's just not the radical nature of love that Jesus calls us to in the gospel. And so I find that the moment that we're in has given us a chance and to pause and to ask a couple of questions. One of those were posed by Claire up front in the words of Jesus, is who is our neighbor? One of my favorite theologians, Bono from U2, says that distance does not determine who and who is not my neighbor, right? And so if I live in a white suburb, my neighbor is not just my neighbor that lives on either side or across the street. They are, but it really asks us, the gospel asks us to have a metanoia, this paradigm shift that opens up the world so that our neighbor becomes those that are in need, that may live 5 miles from us, as they do in my case, in northern Spring Branch, where there is a concentration of undocumented immigrants that I'm and a community of us are in deep relationship with, or in the near north side of Houston. So the who is our neighbor is not determined by our zip code, because what our zip code does determine is our health outcomes. It does determine our economic outcomes. It does determine our educational outcomes. And you add race to this equation, and there is a presupposed death by structural poverty that is at work in this way. As I reflect on this, I hear the echoes of John Sobrino, the Latin American theologian, who says, for the poor, the world is a concentration camp. I need to sit with that for a while. I mean, that could be easily a bumper sticker that I go, oh yeah, that's true. But I have to sit with that in a contemplative practice and let that sink in and let the Spirit of God do work in me around the fact that when I pray, give us this day our daily bread, and I open up my refrigerator and I have 2 weeks of bread in there, I have never had to ask the question as a white man living in an upwardly mobile society, whose bread am I eating, right? Whose bread am I eating when 5 miles away in my own community, there are people today that are going to bed hungry, right? And so part of the work of the movement of the gospel in this time is for a metanoia to happen, an opening up and a paradigm shift. I think it's a movement towards solidarity, and solidarity means is different than racial reconciliation. A solidarity means that in my own actions, I'm going to get into good trouble. Often white folks start with racial reconciliation when it comes to deal with equity issues, where I want to kind of hold hands and sing Kumbaya and to say to my Black brothers and sisters, I'm not a racist, I'm a good one. I'm a good white person, right? What our Black brothers and sisters are saying is, I don't want to be your friend. I want to see if you're really committed to the ways of the gospel, and if you're willing to get in good trouble enough to get yourself in a situation where I'm in. And so part of that movement is towards that movement of solidarity that I want to say. And so I'll leave it there, but it's a delight to be here with each of you, and thank you.
Thank you so much, Matt. I really appreciate it. And just as you said, you need to sit with and meditate on this idea of concentration camp. I'll definitely be sitting on and meditating on much of what you said today. So your presence is so valuable here. Our final speaker today is Reverend Dr. Fred Smith, who'll be speaking on the Confessing Church. Reverend Dr. Smith is former director of the Center for Leadership and Public Theology, professor of urban ministry, and associate director of the Practice of Ministry and Mission at Wesley Theological Seminary in Washington, D.C. He served as a faith and health consultant at Wake Forest Baptist Medical Center and Methodist Le Bonheur Healthcare System. And in addition, he is a former president and founder of the Center for Hope and pastor of Fellowship United Methodist Church in Ambridge, Pennsylvania. He served as associate director of the Interfaith Health Program at the Carter Presidential Center in Atlanta, Georgia. He obtained his bachelor's degree at Harvard College, his MDiv at Perkins School of Theology at SMU, and his PhD at Emory University. He has participated in and directed a number of national initiatives, including United Methodist Council of Bishops Initiative on Children and Poverty, the Southern Christian Leadership Conference's Stop the Killing campaign, the Carter Center's Whole Communities Collaborative, and more. He has authored or co-authored many articles and books, reports, and curriculums, and is currently working on his newest title, We Are the Beloved Community, a Practical Theology. So, Reverend Dr. Smith, thank you so much for being here, and I look forward to your comments.
I want to thank you, Stuart and John, for thinking of me, especially in the context of this illustrious panel that you have put together. I have been educated, I've been inspired, and look forward, especially Brother Matthews, of meeting you, because I've heard a lot about you as well. I don't think I'll be in Scotland anytime soon, Brother Swinton, but so that will happen. Clara, thank you. But let me just say, you know, I don't have to meditate on what it means to be in a concentration camp because you're poor. I live in Sunnyside right now, and I was born and raised in West Oakland in the 50s and 60s. And I think that's an adequate description of those who see no way out. One of the issues that we had when I was working with the Carter Center and others related to gun violence is to talking to young people who did not and could not see themselves living to become 21 and 18. They were lucky, you know, and there was no escape that they can foresee other than perhaps sports or music if they were that talented. So that's a very real thing. Now I work with the Texas Annual Conference on Church and Health initiative that Kim Mayberry, I see who is here, helped to pioneer with Houston Methodist Hospital. And I've seen congregations do many things and work on many things and do tremendous work in the community trying to alleviate suffering and hunger. I could name many churches, St. John's Downtown, Trinity, the Methodist Church of St. Mary's, and others. But that's not the question that I think is being asked here. I too am when I first heard this title, the first thing that came to mind is the church complicit in the health injustice and what is going on. And that was my first thing. The church needs to confess its complicity, you know, in racial and racial discrimination, systemic racism, the pandemic, social determinants of health, and all of that. If nothing else but by its silence. But I think it's even more than that. I have been reading a book lately by, I think it's, let's see, Harriet Washington, called Medical Apartheid. And there's a conference going on right now in Vanderbilt that talks about revisiting American apartheid and talking about justice, politics, and so forth. What is happening now is not a new phenomenon. It is something that is ingrained in the very essence, you know, of American society. African Americans have always been the most prevalent in cancer and diabetes and you name it. And so it's not surprising that with COVID-19 is happening. And Black bodies have always been looked at as disease, carrying pathogens, an ugly, you know, Black, ugly, disformed, and curiosities. And for many hospitals, the hospital movement, when it was first started, oftentimes used Black bodies for cadavers to train medical students. You know, the price of being treated in the hospital, it was only for the poor. The rich didn't go to hospitals, doctors came to their home. It was for the poor, and the treatment of that was that when they died, their bodies would stay there and become cadavers for medical students. And many of those hospitals were religious hospitals. So I'm not surprised at that. So I was beginning to think about it, but then I began to think about Bonhoeffer. I also studied Bonhoeffer, you know, and he was a very foundational, you know, the cost of discipleship, chief grace was something that was always being talked about, especially as we began to get into liberation theology and Black theology. This was one of the foundations. And the notion then, I began to think about the concept of confess in whole different ways. Not as admitting of something wrong, but as proclaiming Christ. You know, and this was the essence of what Bonhoeffer, when he was executed, was not because of this voluminous ethics that he wrote as a theologian, but because of his praxis. You know, and because leading a movement of dissident churches that moved away from the mainstream, that found accommodation with a fascist government, to those who began to proclaim what Christ was and what Christ means. And when I think about some of the quotes from Bonhoeffer reporting to me, is that we are not simply to bandage the wounds of victims beneath the wheels of those who will love their dream of a white Christian supremacist community, my paraphrase, my insertion, more than the love of the Christian community itself, and become destroyers of that Christian community, even though their personal, and this is something that I think we ought to discuss, because we've been thinking about this in terms of personal piety, a personal relationship, destroyers of that community through their personal intentions may never been so honest, earnest, and sacrificial. Christianity, another quote, Christianity stands or falls with the revolutionary protest against violence, arbitrariness, the pride of power, with its plead for the weak. Christians are doing too little to make these points clear. Christendom has adjusted itself far too easily to the worship of power. Christians should give more offense and shock the world far more than they're doing now. I mean, this could be written today for me. The world is overcome not through destruction, but through reconciliation, not ideals, nor programs, or conscience, nor duty, nor responsibility, nor virtue, but only God's perfect love can encounter reality and overcome it. Nor is it some universal idea of love, but rather the love of God in Jesus Christ, a love genuinely lived that does this. We must, another quote, we must finally stop appealing to theology to justify our reserved silence about what the state today, my quote, is doing, for it is nothing but fear. Open your mouths for one who is voiceless, for who in the church today still remembers that this is the least the Bible demands of us in times like this. In justice, we ought to drive a spoke into the wheel itself. That to me, that's the Bonhoeffer, tradition, which I think is important for us today. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. That's not a quote that's very often heard by Martin Luther King, but for me, the essence of that is that injustice in healthcare is not to be separated from what happened to John Floyd. I mean, it is of the same essence. Now, the question for me, it's not so much what the church voice is, but what the voice, the particular aspect of the church. There's pastoring, there's good teaching, there's the ethicists, but there's a particular string of the church that speaks for God, and that is the prophet. And I believe Bonhoeffer was a prophet more than a theologian or a pastor or anything else. And those words he spoke were prophetic words because they were not only relevant for his day, but for every day to come, to which the situation had not changed. And one other such prophet was John Lewis, who just recently died. I mean, he could have spoke these same, I'm sure he studied Bonhoeffer. But I'm sure he spoke many of the same words. In his last letter, the first excerpt said, "While my time here has now come to an end, I want you to know that the last days and hours of my life inspire me. You fill me with hope about the next chapter of the great American story. When you use your power to make a difference in our society, millions of people motivated simply by compassion lay down their burdens of divisions around the country and the world set aside race, class, age, language, nationality to demand the respect of human dignity. That is why I visited Black Lives Matter Plaza in Washington, D.C. Though I was admitted to the hospital the following day, I just had to see and to feel for myself, after many years of silent witnesses, that truth is still marching on. For me, we're living in one of those times. I wish I had my other computer and I would put this up on the screen. But Jonas Salk, the one who found the vaccine or the cure for the last great epidemic, polio, drew a line of history that was an S curve, the continuance of history. And there were certain junctions in history that he called an inflection point. And this is where history is broken apart. This is an opportunity, and let me just read this. We are in times of discontinuity. This is the time we are now, an inflection point where God intervenes in history with a new vision. It is the leadership practice emerging in discontinuity. It assumes open space. It's a time of choice between God's future and our own, in which leadership is possible in ways in different times dominated by stable systems. This is a time with a pandemic that has shut down the country. This is a time when the whole nation, Black, white, around the world has come face to face with injustice through George Floyd and others that are listening and are hearing and demanding chances. This is a time when great prophets like John Lewis and C.T. Vivian and many of the great prophets of the last generation have died and are passing on the torch to a new generation. So I don't speak for the white church, but it's very instructive that in the middle of the riots, and not the riots, but the peaceful demonstration in Washington, D.C. in front of the White House, that the military was used to break them apart, to move them out the way, so the president could stand in front of a church with an upside down Bible. Why? 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 It was because his base is evangelical Christians who have a political agenda, which they believe is a good agenda, abortion and other kinds of things, which they believe is human rights, but it's also infected by white racism. And that was the support. The church needs to confess. It needs to confess Jesus Christ. And confession is not just an individual, personal taking on the guilt or sacrifice or repentance, but it is the body of Christ that is assembled in congregations, in denominations, in synods, or whatever, that at a time like this cannot afford to be silent. Because what we do today, what we profess and confess today, will determine what the future of America, perhaps even the world, could be. To vote, to be counted in the census, to run political candidates that are beholden to the people and not to industrial or other kinds of interests. The decisions that we make this year at this time could have an impact for hundreds of years to come. And I don't think that's an over-exaggeration, to tell you the truth. We're at a pivotal time. So where is the voice of the church? I think that there are many out there who are doing a lot, who are speaking, but not loud enough. And they're not enough getting into good trouble. And so I think for me, I will confess. And that's why I wore my clergy today, so I can take confession. I will confess that we as a church, and I'm talking about the Black church as well as the white church, have not spoken loud enough or done enough. I love Cure and those young people there, excellent scholars out of Rice and other places who are speaking and who are holding the dialogue, that's tremendous, that generation. But it needs the white church and the black church, you know, the evangelicals, and they're good people. I'm not condemning anyone. Let me conclude this. I don't want to go over my time, but I want to conclude with this, because I have what's called a social theological ethic to guide action and work. And if you listen to this, this is very much with John Lewis, with Martin Luther King, with C.T. Vivian, you can go down the line. They were coming out of an ethic of the beloved community that was first written about and propagated by that great pacifist Josiah Royce. And he said, the beloved a community where love and justice rule, in a community of unique, distinct individuals who are loved for who they are in the polarity of their circumstances. Yet they share a common memory and future. It's a community of interpretation where our stories, our context, our future, our hope have meaning and inspire hope, and each individual is assured that they are lived. In a document that I helped to create for the United Methodist Church Children Initiative on Children in Poverty, we broke it down this way: that a beloved community, our actions should be judged with these 5 principles. 1, love and justice rule in our politics, in our governments, in our communities. It's a community ruled by love and justice. 2, everyone has worth, human dignity, black, white. It's not, yeah, Black Lives Matter, but all lives have worth. Okay? So I don't diminish, you know, all lives have worth. And this is what John Lewis stood for. And this is what King got in trouble when he defended the Vietnam, when he protested the Vietnam War, because people say you need to stick to black people. And he was going on this ethic that every human being has worth. That diversity enriches all our lives through our common memories and our shared future. And I think this is critical, because this is based upon the personalism of King that talks about every individual being created in God's image. If this is true, then whether you're black, white, Chinese, Indian, Native American, your face is the face of God itself. And unless we can see the face of God in every individual, regardless, then we need to celebrate, seek diversity. This is a concept. This is an ethical framework. Our stories as a community of interpretation, and this is what we all are. We interpret each other's stories. You know, and so if our community that's based on love interprets stories that inspire hope, not detriment, not despair, we have the opportunity to take a crack addict, or to take a single mother, or to take a homeless person, and to look and hear their story and interpret it not for their detriment, but for the hope that's inspired them. And if we're not interpreting people and connecting people in this way, then we are violating the ethics of love and the ethics of Jesus Christ, because that's what he did. As you read the Gospels, he didn't meet prostitutes, he didn't meet tax collectors, he met people and interpret their story toward eternal life. And that we are all loved, every one of us loved unconditionally forever. And I quote Rudy Rasmus down at St. John's, that I love you and that there's absolutely nothing you can do about it. And that is the basis of nonviolent direct action. You can beat me, you can spit on me, and you can take my very life. I will not put up with your discrimination and your racism and your infliction of my past, but I'm not going to hate you. That no matter what you do, you are created in the image of God. And then it's on me and how I feel and what I do about you. So where is the voice? The voice is in its prophets. It's not, it is in those who I forget the scripture now, forgive me. But the word says that God would do nothing, I would do nothing unless I first reveal it to my servant, the prophets. And we have had prophets in our time. And right now is a time for us to begin to listen to our prophets, to our voice. And they are speaking, but we're not necessarily listening. Thank you. That's enough of that.
Thank you, Dr. Smith. So appreciate your presence here. your profound reflections, grounded in both a masterful understanding of the theology of Christianity, but also in your lived experience. Just appreciate your friendship, your relationship with ISH, and the work that we've done together. So I'm going to turn it over to our Q&A and discussion moderator, Reverend Blanton. We are encouraging you to submit questions via the chat box. If they're for one panelist, you can say so. If they're for multiple, you can also say so. Unfortunately, Dr. Swinton needs to leave a little bit early. He may already be gone, but if not, shortly. So if you have one question for him, then it may be worth asking sooner rather than later. Thanks, Reverend Blanton.
Yeah, thanks. That was an amazing assortment of papers, and I love the way that they all melded might just be the wrong word, but they all tie together some very important themes we've been talking about recently in our current events. So we already have a couple questions coming from the chat. So I'm going to start just going in order from, first one's from Amy Vogel. And she says that there seems to be a marriage of our white normative supremacy theology with capitalism, and that she has gotten a lot of pushback to her white faith family based on her support for Black Lives Matter and racial justice equality movements, that this movement is rooted in socialism. And she wants to know if this is a misunderstanding what socialism is and how that connects to Jesus calling us to heal and right wrongs in our society. Is this a political agenda that we're being brought into? And it just seems prevalent with the people that she's trying to get questions from. So I guess this boils down to what degree does this movement, does Black Lives Matter, I'm trying to think of a way to phrase this all well. Is Black Lives Matter inherently anti-capitalist? And is capitalism in itself a form of racism? And how do we navigate that discussion with people who maybe are sympathetic to restoring racial justice, but maybe don't see the economic side as being problematic? And I'd love to hear thoughts from Reverend Dr. West and Reverend Dr. Russell on that. So whoever would like to start.
I'd like to first give the floor to Dr. Russell, if you don't mind.
Sure. Take a crack at that. I'm not an economist, but I think part of the issue that we're facing in this right now is that our imagination has been so constructed and formed by the political and the ideological that we see these things then within binary left-right socialism, capitalism. I think that there's another way of constructing this around neighborly economics. And I think the kingdom, although the kingdom that Jesus talks about really upends kind of what it means to be neighbor, what it means to have brothers and sisters, and who's in and who's out, all those kinds of things. And so we have been so formed in our own imagination and a privatization of kind of the market and the free market consumer economy that's the only way that we can see. And so socialism comes along to try to dislodge some of that and pushes it towards another place that then mandates it from on top, right? And so the question for, and then we get into all these kind of questions about then kind of private rights and rights as an individual, which is so ingrained within the country that we live, even to the point where, you know, mask wearing is deemed to be a political statement, right? So thinking about the common good in the language that has really been hijacked in our culture in this time is a really difficult thing. So we're living, I think, in an age of extreme anxiety where people are constricting around self-preservation. And so it's deeply, it's not intuitive then to say the only way out of this is, as Dr. Smith said, is to become more generous. is a generosity of who is my neighbor. And so I think that there's been some work that Peter Block has done, and Walter Brueggemann, some of those folks have done on neighborly economics that I might refer you to. And then also ways in which neighborhoods are taking care of each other in this time, whether that is, I know some folks are figuring out how to co-buy houses for folks that need housing. So it makes this kind of global economy much more local. And how do we do that together? I think there's ways of sharing in on that. But I also, Amy, to your point, there's a lot of folks that in my community that are being pulled into those kinds of discussions that are saying this kind of either or, well, this sounds a lot like socialism and I can't have any of that. When we begin to talk about neighborliness, our imaginations have been so framed around that part of the metanoia, the repentance, this new paradigm shift has to come with this deep work that we need to continue to do and be shaped by the gospel in those ways. So.
Yeah, I wanted to ask Russell to start on that, because I don't have those discussions in my community. Capitalism, socialism are in the hands of those in power and who run them, and are guided by the philosophy, the thought processes, and the prejudice of those in charge. So you can have a racist socialist government or a racist capitalist government, or racist, so I don't think, I am an economist. My degree is in economics, and I've worked in business and banking, for many years. And I know the chief issue is what is the value of human life? In capitalism, oftentimes that is determined in terms of a capitalist value, monetary or some other. Slavery was in order to increase the wealth. It was justified through its racism, it was justified through the church, but it was basically an economic issue. And I don't think it really matters whether they were communists or capitalists. They were seeking to use another person as a human being as capital, and value them according to their ability to produce, wealth, period. And so the reasons why they chose African, because there have been white slaves, there were white, bond servants and so forth. But the reason why they were able to take human beings in a chattel capital with not endowed with human characteristics or human value, was not because of capitalism, but was because of innate racism, and oftentimes justified by the church.
Thank you. I'm going to try to combine 3-ish questions because we have about 10 minutes left of this. And I'd love to hear Dr. Smith's thoughts on this first this time, just because you're talking about what it means to actually engage, like boots on the ground work. So the 3 questions tie into this idea of in our local communities, there seem to be, especially in local white communities, there are apparent blocks to doing more. Either people feel helpless because they've encountered this history of systematic racism and they're like, I don't know what to do with this. What do I do? Or you have divisions in the church where one group says, yes, we want racial justice, but that's divisive and we value unity and we don't want to go out and seed discord. Or we have people who are major donors in the church who give to the poor, but then don't actually do less harm as a result, and kind of have this white savior complex. And I think all 3 of these questions get to this question of how in the local church, especially for those of us in white churches that want to be more proactive, what can we do to actually do that better and overcome these hurdles that certain parts of our church families might be putting up?
I have little experience with that kind of conversation. I mean, not that I haven't heard it, not aware of it. Actually, I'm in the United Methodist Church. I've pastored a church that has been primarily white and working class, so I am familiar with that conversation. But let me go back, to what I think is the critical issue here. When people ask, what can I do? They can do a lot. I think I go back to John Lewis as you need to get in trouble, because you will get in trouble if you go against the flow. You will be ostracized. But, you know, Jesus said, rejoice when that happens, when they call you bad names, because that's what they did to the prophets, you know, and don't worry about trouble because it makes you patient, you know, and so forth. So it's no way around it. There's no easy way around it. People have been grounded, have been taught and raised in certain kind of social conditions, often in what they call them silos, you know, of theology, and silos of philosophy and ideology that has shaped who they are, whether they want to admit it consciously or not. You know, they have certain behavior cues. And so when people become enlightened, when they become aware, they have two choices. They can keep silent and fit in, and that's cheap grace, as Bonhoeffer would say. Now, I mean, you go back to Bonhoeffer on this. Bonhoeffer would be the perfect person to bring into a Bible study for this kind of conversation. But this is exactly the conversation he was having in Germany while they were assassinating and exterminating the Jews. You know, is it all right if somebody is fleeing from the authorities and come to hide in my house, you know, and the authorities come and ask, is somebody hiding your house? Is it all right if you lie? Well, that would be against the 10 Commandments. You know, Kant would say, no, you tell the truth, you know, and let the man, you know, go to a thing, but you stay pure. Bonhoeffer says, no, you lie. You go against it. You get in good trouble because that's of a higher value, you know, than the others. So I would have to say to those people who you're referring to, what kind of disciple do you want to be? You know, because discipleship costs, as Bonhoeffer would say. And it may cost your friendships. It may cost, you know, being exiled or from your family. You know, it may cost your job. And in many cases, it may cost your very life. This has been the case for most Black people. You know, and so there's no easy answer to that. There's no convincing people or changing their minds except by your actions. You know, I was listening to somebody today, and somebody was talking about either we are what we do or we do what we are. You know, the question is that, to me, and it came down, is that you do what you are. You're not are what you do. You do what you are. And so I think you have to ask. I'm talking too long. Sorry, excuse me.
That was great. Dr. Russell, do you have anything you'd like to add to that?
I think that that we're seeing the limitations of the institutional church in this way. Is what we've begun to see is that the institution taking care of itself and its own sense of prominence in society, rather than its missional impulse, which is always its essence, which is to move to the margins and to make sure that that there is equity, that there is enough, that the comment between scarcity and generosity is where we live. And so we live in a world that's been deeply formed by this notion of scarcity. There is not enough. And so the way the white church is moved many times in its own privilege has been then to hoard that and to say, I'm afraid there's not going to be enough. You know, and so we don't hear the cry of the needy. We can't move beyond that because really the center of us exists an idol of our own self-preservation that we don't come to grips with. And so much of the church's preaching on Sunday in white contexts can live under and operate under the umbrella of why actually you don't have to follow the Beatitudes, the Sermon on the Mount, right? And so we can lather up a lot of psychological kind of constructs, but at the end of that, the church is a social movement that is to include an equitable way for all to be included and to have enough. It is not an institution that exists for itself. And so we are best when the church is a social movement crossing and spanning boundaries and learning how to live out a new humanity in that place where there is neither Jew nor Greek, slave nor free, gay nor straight. You know, all those have a place, but that we're not operating and dividing ourselves among that. There's got to be a better way.
Thank you. I'm going to turn it back over to Stuart because I think we're at the end of our time for today, but I've loved having this conversation with you. Dr. Smith, I'm definitely going to now go back and think about Bonhoeffer saying to make good trouble, because I love that idea of what he's saying in his context as making that good trouble that John Lewis talks about. That's definitely going to be something that rolls around in my head for a little bit. So I will turn this back over to Stuart, and just thank you again for coming out today, spending some time and participating in this panel discussion with us.
Thank you so much, Claire. Just a big thank you to our panelists. Dr. Swinton isn't on anymore, but we'll do a virtual transatlantic thank you to him. And thank you in particular also to you, Claire, for kind of inspiring this event with your work. We shared a wonderful lunch with your family that day, with John, and really got our wheels turning about how to incorporate some of your work into a panel like this. So thank you for your interest. Thank you for your time on behalf of the Institute as well as our speakers. And we'll look forward to seeing you at the next program. Thank you so much.